Press conference outlining the first phase of lifting restrictions, which begins on Monday. That's following decisions that were taken at a cabinet meeting this morning. The Taoiseach and some government colleagues will hold a press conference shortly at government buildings, and we will bring that to you as soon as it happens. Our correspondents will bring us analysis before and afterwards. I'm joined in studio here by our science correspondent George Lee, and from government buildings by our political correspondent Micheál Lehane. Well, let's go to you, Micheál, first. What are we expecting at this press conference? We've already seen one change today in that homeware stores won't be opening as planned. What else do we maybe know?
Yeah, I think it seems clear enough that largely what was set out in that document a fortnight ago about phase one, that is going to happen now. Homeware, as you pointed out there, not going to happen though. They're saying that stems from confusion about the language that went in. But of course we do know that big stores were getting ready to open their doors on Monday, big homeware stores, and that won't happen now. And I think that is going to lead to a charge from the opposition that there is some confusion about this key next step. But the cabinet meeting this morning was described as calm and focused throughout, and what you are going to see on Monday, I suppose from a work point of view, the big thing is that construction workers will be back on sites on Monday morning, gardeners also, and outdoor workers. Then a range of shops ranging from hardware shops to garden centres, farmers markets, also motor repair garages, bike repair shops and IT and electrical shops. They are all set to reopen, and there's going to be some key advice too about that proposal that people will be able to meet up outdoors in groups of four, meet people from outside their household. But I think there will be a message emphasised repeatedly this evening, and that is that people, while they can do that, it must be within that 5 kilometre limit, and people will be told in fairly strict terms that they're not to visit the inside of one another's homes. Also some advice in the aftermath of this cabinet meeting on face coverings. The government, of course, not using the term face masks, but face coverings, and there will be advice that they should be worn in indoor settings where social distancing mightn't be possible to achieve.
George, those slight changes that Micheál's been outlining, there's no risk involved there. Sure there's not. I mean, the government has looked at a series of criteria before coming to whatever decision they're going to announce here.
I think, Katrina, the reality is there's risk involved in everything. It has taken us a long time to get this to this point. We're now 8 weeks in effective what we call now lockdown, although it was never described as such by the National Public Health Emergency Team. And that was to get the reproduction rate of the virus down from 3.7 first to 1.6 to 0.5, where it's been now since the end of March, which has been a huge achievement. That took a lot of work from people, and the social distancing and so on, and investment. But that's the risk. The risk is that we know that when people move around more, that the virus will reproduce more. And the 0.5 rate, which means effectively if 10 people catch it today, they will pass it on to 5, and those 5 would pass it on to 2.5, and that means that it would dissipate over a period of time. That will go up. And the big thing that they're watching, the biggest risk they have, is when people go back out there, they know that this is going to go up. It's how much does it go up, and what do they have to do? We're not out of the woods yet. We're not out of jail as such. And when they're watching this, they're very worried about what's going to happen in terms of people's behaviour. So they're taking this very carefully, very softly. Give it 3 weeks to see what happens when you ease restrictions a little bit like this. We're coming from a position where we've made great gains, but we have to remember that when this whole thing started at the end of February with the first case, we had one case, and that resulted in what we have today, which is nearly 24,000 tested positive and 1,500 people have died. We're at a situation where yesterday, even if you take account of the cases in terms of the hospital, at the Mater Hospital, which had been held back in terms of reporting, we've nearly got 200 cases a day positive. So the risks are that this really, really aggressive virus, in terms of its ability to spread, could get out of control. So yes, they're taking risks, but these are risks that they feel they're safe to do so. They put in place things such as contact tracing and testing.
And the key message is still stay at home, though, isn't it? Even with some of the restrictions that are to be eased, you're still supposed to stay at home in so far as possible.
And that's absolutely true, because they're saying still within 5 kilometres, you know, they're saying they might open up beach car parks and beaches and stuff like that, but if you're 5 kilometres from the beach, they're telling you that's unnecessary travel. So it still is all about, remember, we're still in phase one of this. We're trying to take baby steps to get to the point where people can have more freedom, and if we blow it on stage 1, we will not get to stage 2 anywhere near as quick as people think. So they will be really urging people and stressing, I think, the caution about this. We still have work to do.
And what about what Micheál said there about possibly some announcement regarding face coverings in public?
Without a doubt, there will be. Because when you see it, and as I just described, the risks we're taking, what you've got to do is, if you're about to take them, do everything you can to minimise what could go wrong. And what is known is that a person can spread. And this is different to what we knew a couple of weeks ago or 2 months ago. We did not know that people who did not have symptoms of this disease were capable of spreading it. Asymptomatic people. We did not know that in the 2 days before you have symptoms, you're spreading it more than the days when you have symptoms. So they're saying you don't know when you see somebody whether they have the virus or not. And what can help is if they have a face covering, which would mean that would minimise the ability or the likelihood that they would spread it. And so the advice from the European Centre for Disease Control has been for some weeks to advise people to wear face coverings as a mark of social solidarity, not to protect yourself, but to protect everybody else. But there are big concerns that the NPHET has about that. They're not effective in terms of protecting you. You can touch them in the wrong ways, which means that you can spread the virus back to yourself. It can go back into your eyes. There are lots of education that they're going to try and get across to people about how to use them, but they certainly look that in enclosed spaces, places where you can't distance, the likes of public transport, the likes of shops and so on, that it would be helpful if you did that, but not compulsory at all, because some people have difficulty wearing them.
Now, we're told these lifting of restrictions are evidence-based, and as you said, George, they're a key part of that are these statistics around the number of new confirmed cases. And you mentioned there the situation yesterday with the Mater Hospital. We're joined now from the Department of Health by our correspondent, Orla O'Donnell. Orla, this situation where the Mater Hospital yesterday declared 244 cases dating all the way back to March. What more do we know about that, and was it a one-off?
Well, it's understood these cases, Katrina, relate to healthcare workers in the Mater Hospital. There are 244 cases. Now, healthcare workers go through a different stream, if you like, to patients in the hospital. They're assessed by the hospital's occupational health department, and that ties into what Dr. Tony Holohan was talking about yesterday at the briefing when he mentioned the occupational health department of a hospital. And they're notified separately to the HSC, separately to patients. So in a statement, the Mater Hospital said it had reported all cases of COVID-19 positive results to the relevant authorities on a daily basis. And it said at all times the hospital provided the information the HSE required and met all legal requirements to report infectious diseases. COVID-19 is a notified disease since February 2020, and doctors and medical officers in hospitals have to notify the health authorities if they have a case of COVID-19 forthwith. The Mater Hospital said it did this. It said all of the information it has is correct and up to date, and it said it will be working with the HSE to find out why this data may not have been accurately captured. The HSE said it was not in a position to confirm whether the hospital did or did not report the cases, and this was one of the matters it has under review with the hospital group and with the hospital itself. The hospital also said in relation to contact tracing that it has carried out comprehensive contact tracing on all staff members who've tested positive for COVID-19. Again, that is something that is done by the hospital, by the occupational health department of the hospital itself for its own workers. So there's a difference of opinion, or certainly we're not sure what happened exactly in this situation. The hospital is very adamantly saying that they did everything as they should have done. They reported all the cases as they should have done. Dr. Tony Holohan saying yesterday that there were these cases which had been reported to them by a single hospital in one block, and it's not clear why that happened. There is the Minister for Health said this morning that he would be seeking assurances that it wasn't happening elsewhere, that it hadn't happened elsewhere. He would be seeking assurances from the HSE to that effect. There is a briefing due here this evening, and it's expected we will hear more about this issue at that stage.
All right, Micheál, are we expecting to hear more about that issue or testing and tracing in general at the press conference there when it gets underway in the next few minutes? We've been told this is a key element to easing any restrictions.
Yeah, it is. Contact tracing is a key element, but I think the app that's going to be used and was regarded as one of the key parts of that probably won't be ready until next month now. And of course, there has been criticism, and fairly strong criticism, in the Dáil yesterday about how contact tracing is going at the moment. Dennis Naughton saying that it is intermittent at best, and saying that it was fundamentally failing. That was his view, and that there was a particular context to that was around what is happening in meat plants in parts of the country. I think something that we may hear a little bit about as well here on a different issue, and it's something that isn't going to happen next Monday, but that question of horse racing taking place behind closed doors. Of course, that industry applying a lot of pressure on government in recent weeks to try and get up and running again, if you excuse the pun. It looks like that will happen ahead of schedule now, not at the end of June, but on June 8th. That looks to be a decision of Cabinet today. And as I understand it, there was a meeting before Cabinet between the Agriculture Minister whose responsibility for this area, Michael Creed, and the Taoiseach. It was something that was raised repeatedly at Fine Gael parliamentary party meetings as well, especially by TDs whose constituencies have a fairly strong horse racing element and sector to it. So that is something that from the earlier part of the roadmap has been brought forward a little. So we'll have to look out for things like that. Are there things that will jump forward and come in earlier phases from now on?
All right, thanks, Micheál. George, that's a point, isn't it? The government has to balance the economic impact of COVID-19 with the public health and public safety issues here.
Well, they do, but remember that the economic impact can be worse if you stop and start. So it's a strategy with regard to try and make sure you don't, and by that I mean if they lift restrictions to help the economy and the virus grows and they've got to put them back in, sure, that's worse. So that's why they have to really be very careful about how they're doing it to make sure that we get a smooth trajectory out of this. And that's why they put in all the tests. I mean, the Taoiseach was very clear about what he was saying. This is how we're going to judge whether or not we can take this next step. One of them, as Micheál said there, was contact tracing, and the HSE has a brand new system operating from Monday coming, where people, what they're saying is that when they will be able to do 15,000 tests per day, that they will be able to have 15,000 tests also through the laboratory. So swabs 15,000, laboratory 15,000. And for 97% of them, they're saying at the moment they're negative. So those people will get an immediate text back, a text this time, not going through the doctor saying you're negative. So they will get the result within 48 hours, 2 days. And then of the remaining 3%, that most of them will get it within the following day, including contact tracing. So they're convinced that they have a system in place. The government is happy with that. The Chief Medical Officer said there's nothing about the contact tracing which would cause them not to ease these restrictions, but it is really important because you need eyes on where this particular virus is going to crop up, and the contact tracing and the testing is absolutely essential for that. So that's why the HSE has been under pressure to change the system, and it comes in from Monday.
We can just take a look there now at the Government Press Centre, that press conference with the Taoiseach and some other government colleagues due to start around about 4 o'clock. Obviously, it hasn't started yet, but we will bring that to you when it happens. George, with the widened test criteria that we saw come in the last week or two, and now with the easing of restrictions, presumably on some level, the number of positive cases is going to go up anyway.
Well, it's less so on the easing of the criteria for testing because it's different to what we had before. 2 or 3 months ago, the flu season was still in operation. So people had symptoms which looked and felt a little bit like they could be COVID, and they were going for tests. So there was a backlog. On this occasion, they don't feel that people are coming forward, anything like that. So it isn't so much that you're going to see a rise necessarily in the number of cases. For instance, if you did tests as they are doing now in meat factories and in direct provision areas where they know there are clusters, you will get increases on a daily basis. But it's very clear from all of the numbers that the trend has been very solidly down since about a month ago, to such an extent that we're heading towards 150 per day or thereabouts, and they expect it to remain like that. But again, it's all up for grabs, and they will watch it like a hawk. They'll watch things such as admissions to hospitals. And we know, for instance, that admissions to hospitals, general hospital wards, they had been running at something of 100 per day about a month ago. They're down to 15 per day for COVID-19 patients. They'll watch in terms of intensive care units, because it's a critical factor in terms of a proportion of these people get very sick. And that's come down from 14 per day new admissions a month ago to just 1 or thereabouts in the most recent days. So these are the kind of criteria which let them know how serious it is in the community alongside the testing. But they're really, really important to put it together and not look at one particular instrument or one particular number.
And Micheál, is there a sense that the other opposition parties have been consulted on the decision-making process, or have they been briefed in advance of this press conference now?
Yeah, I think there is a sense of inclusiveness at that level, and there is no doubt at the same time, though, that broad political consensus that existed up to now, that continues to fray. And you can see repeated questions about the competency of government to deliver on this roadmap, to deliver on the reopening of society and the economy. And I suppose there's a few reasons for that. One is the handling of the Leaving Cert issue last week, and then most recently that entire issue, which many would say was a debacle in the end when it came to setting up a structure where the children of frontline health workers, childcare would be provided to them, the government having to abandon that plan in the end. For those reasons, you see a greater scrutiny despite those continued briefings between government and opposition. And when it comes to briefing, I think it's interesting too that, as I understand it, around 2 o'clock, Leo Varadkar did call Arlene Foster and Michelle O'Neill in Northern Ireland to inform them about what the Cabinet had decided about moving to this first phase of easing the restrictions. And there is expected to be at some stage too, if it hasn't happened already, it's not confirmed yet, some contact with the British Prime Minister Boris Johnson to also inform him what's happening here.
Because there has been a lot of criticism about the lack of a sort of all-island approach to this, hasn't there?
Yes, there has, and I suppose there was particular criticism when those initial steps, that very slight easing of the restrictions a fortnight ago, when people cocooning were told that they could get out to take exercise, and where that 2k limit was extended to 5k kilometres for exercise. That wasn't first flagged with the executive in Northern Ireland, and then some of the language afterwards used, in particular by the Social Protection Minister Regina Doherty, when she talked about the need to inform people here first, didn't go down particularly well. A far more diplomatic approach has been taken on this occasion, it seems.
And Orla, after whatever we hear this afternoon, whenever this government press conference does get underway in the next few moments, as you say, there will be a briefing there at the Department of Health later on. Are we expecting to hear any further details there?
Well, we certainly will. The Chief Medical Officer, Dr. Tony Holohan, will be here. He will give the usual daily update on the numbers of people who have sadly passed away and the numbers of new cases. There's absolutely no doubt that he will be asked further questions about what has happened in the Mater Hospital. Obviously, people are concerned. They want to know that this hasn't happened in any other hospital. It's also probably worth bearing in mind that the Mater Hospital has been at the forefront of this battle against Covid-19. They're based in North Dublin. They have consistently had some of the highest numbers of confirmed cases of Covid-19 over the past 2 months, the highest number of patients in intensive care. At some stages they haven't had spare beds in intensive care. So they have been working very hard, and there has been obviously an awful lot of pressure on that Mater Hospital. The Minister for Health said before the Cabinet meeting, he acknowledged that people were working very hard in hospitals and laboratories, but he said there was a reason why there was a requirement to notify cases to the Department of Health. So we are expecting to hear more about that particular issue, and I suppose more about the easing of restrictions and what might happen in the weeks ahead, and what the concerns are about the easing of those restrictions at the briefing this evening.
All right, thanks, Orla. George, we're still waiting for the press conference to start. We can take another look at the press conference there. As you can see, there's 4 podiums set up there. The Taoiseach and 3 colleagues expecting to join him. Maybe one of those could be the Chief Medical Officer, Dr. Tony Holohan. But do you have any sense that they might change the roadmap at all, or largely stick to the 5 phases that have been outlined to date?
Yeah, I think it's fairly clear as of now that they're going to stick broadly to what they have at the moment. There are the tweaks which Micheál has just referred to, such as the issue of childcare for healthcare workers, that has been taken out because they couldn't deliver it, and the clarification there about homeware and hardware stores, which one was going to open. I think the likes of IKEA might have felt that they were ready to open on Monday, but I think it's
perhaps a queue waiting outside.
Put back in their box as such, because they're not a hardware store, and it's a big store with lots of people coming, and I'm sure that's very disappointing to them and a lot of other people. But so even when you think about what they said in relation to that, and that was only today, that is like, we are sticking to this plan. There's no wriggle room around it. We're telling you, you're not a hardware store, you're a homeware store, you are not opening. So I think that, if just as a simple example, is indicative that they are sticking rigidly to what they have written down on paper for the moment, because they know what's at risk. And there's no point saying it isn't at risk. It is at risk. We know what we've gone through. We cannot put it in jeopardy, the gains that we've made. This is the plan, and so far there's no good reason for them to change it.
And on that issue of retail stores, hardware stores, opticians, bicycle repairs, mobile phone repairs, all of the things that were outlined initially, it's not going to be a case of the door is open and everyone goes in. There will be very strict new ways of doing business, won't there?
Yes, that's it. And again, we have to think slow, really. You can't just go in and pick things up and quickly. You've got the distancing, the social distancing, you'll have the barriers, you have to go in one door and out another door, all of those things. We've seen in relation to opticians what they're going to do. I mean, they'll make it much quicker for people, but only a couple of people in each time.
I'm just going to stop you there, George, and we'll go over to the Government Press Centre, because it looks like things are about to get underway. As we can see, the two Irish Sign Language colleagues, they're ready to get started. But do you want to finish your point there, George, about new ways of doing retail and new ways of doing business?
And that's it. And obviously...
sorry, I'll stop you again. Here they are, yeah.
Now you can see who the four people are.
So we will go over there to Government Press Centre, and Taoiseach's about to start speaking.
Everyone good to go? Okay. Good evening, everyone. I want to speak to you again about the coronavirus. I can confirm that it is safe to proceed with phase 1 of our plan to ease the Covid-19 restrictions from Monday. The Cabinet made these decisions this morning on foot of advice from NEFIT, and I spoke to the First Minister and Deputy First Minister in Northern Ireland immediately afterwards by phone. Today's announcement gives us reason to hope, but it's not cause for celebration. We've a long way to go yet. There will be bumps in the road, and we have to keep our guard up. If all goes well, we will enter a new phase of reopening our country every 3 weeks, and the next review will take place on the 5th of June. To keep going forward, we need to keep following these guidelines. Everything is provisional and reversible, and our progress depends on all of us continuing to do what we have been doing. As the restrictions ease and we come into contact with more people, the opportunity for the virus to spread increases. So personal responsibility and Cortrum Féine will become more important, not less. So the message today is to stay at home, except for these 5 rules, and I count them. 1, to go to work if your workplace is open and if you can't work from home. 2, to shop for items that you need. 3, to exercise within 5 kilometres of your home. 4, for medical reasons or to care for others. And 5, to meet friends or family outdoors in groups of no more than 4. As a country, we've done a lot to suppress the spread of this virus, but extreme vigilance will be required until a vaccine or effective treatment or prophylaxis is found, and that might be some time away. So every day we need to continue to follow the basic public health and hygiene advice, to wash our hands regularly, maintain a physical distance of 2 metres or more whenever possible, to sneeze or cough into your elbow or tissue, and to stay at home and isolate yourself if you're sick. And an additional hygiene measure is to use face coverings when using busy public transport and when in enclosed indoor public areas, such as retail outlets. As I mentioned, from Monday, we'll be able to meet small groups of up to 4 people outside while keeping at least 2 metres apart. Some people, mainly in outdoor work, will be able to start working again. For example, construction workers, gardeners and people tending to allotments. Some more stores will reopen, and you'll be able to shop again in garden centres, hardware stores and farmers' markets, or get your eyes tested, or your car or motorbike or bicycle repaired. As part of our daily exercise, we'll be able to play a game of tennis or a round of golf, exercise and fitness classes outdoors in small groups of up to 4 people, once you don't travel more than 5 kilometres from your home to do so. Some public amenities, such as public beaches and mountain walks, will reopen, and in every single case, it is vital that we maintain a physical distance of 2 metres. In 3 weeks' time, on Friday the 5th of June, I fervently hope to be here again to announce that we will move to phase 2, a further relaxation of restrictions. This depends on the progress that we make between now and then. Nothing is guaranteed, and the only thing that is inevitable is the spread of the virus if we don't push it back every day. The coronavirus is an inferno that is raging around the world. In Ireland, it is now a fire in retreat, but it's not defeated. we must extinguish every spark and quench every ember. We're all bound together in this great national effort, and we must rely on each other if we are to succeed, which we will. Thank you very much.
Good evening, everyone. The Covid-19 crisis is impacting every aspect of our society and economy. And I want to start by once again extending my sympathy to all families who have lost loved ones in recent weeks. Today in particular, I want to thank all the business owners and workers right across the country for the part that they are playing and the sacrifices that they are making to help us through this unprecedented public health emergency. And I have to say it is heartbreaking for any business owner to look at something that they have put their heart and soul into over many years, lying idle and the doors closed and the lights off. The enormous sacrifices that businesses throughout Ireland have made has helped us to save lives and flatten the curve of Covid-19 to an extent where we are now able to start reopening our economy from Monday. And I'm under no illusion how challenging the coming period will continue to be for businesses. But now we have light at the end of the tunnel, and it's thanks to your hard work and dedication. Today I brought a report to Cabinet on the economic effects of the crisis across sectors. The report takes a detailed look at how the Covid-19 crisis is impacting on the different sectors of our economy. This report, alongside the advice of NEFIT and a separate report on the social implications of Covid-19, were key inputs into the decisions taken today by Government. Of course, all sectors of the economy have been affected to some degree by the crisis. But some sectors that rely on close contact with customers or where remote working is not possible have been heavily hit, including construction, accommodation and food, and other personal services like the arts and entertainment. For example, in the case of accommodation and food, almost the entire workforce in these sectors is on income supports provided by the state. Other sectors that have been hit hard include the wholesale and retail trade, business services, transport and manufacturing. The report recognises, as do I, that we have to keep public health considerations to the fore in our decisions on dealing with this crisis. But we also have to recognise the significant economic damage arising and do what we can to ease restrictions in a safe way that helps safeguard our businesses and jobs. For example, the report highlights the importance of the construction and manufacturing sectors at this time. These sectors are big employers with employment spread across the regions. The construction sector also has strong links with the rest of the economy, and we need to get critical housing and infrastructure projects back up and running. Most of the manufacturing sector has continued to operate as an essential service up to now, and getting the rest of the sector back to work can provide a significant boost to firms in locations right across the country. The National Return to Work Protocol will support businesses and workers across all sectors to return to work safely, starting from Monday. It applies to all workplaces, and it is a critical component of the Government's roadmap for reopening society and the economy. So this isn't just about determining where you fall into the roadmap. You also have to be able to apply the protocol before you can reopen. And I know that many businesses have already been working hard on their plans to apply the guidelines, particularly those who are due to open next week. And I'd like to thank them for their work. And I'd also like to acknowledge that many critical and essential businesses have continued to operate during the pandemic with the appropriate safeguards in place. The protocol sets out in very clear terms for employers and workers the steps that they must take before a workplace reopens and while it continues to operate. And the HSA will be overseeing compliance. Their approach is to work with businesses collaboratively, offering advice and support and helping them to iron out any issues. And they're also there to advise workers who have concerns. That said, if necessary, they also have the powers to take enforcement action up to and including closing down a business. However, I am confident that employers want their businesses to remain open and want to do everything possible to protect and support their workers. We have trusted businesses so far to do the right thing, and they have gone over and above the call of duty, with many actually closing earlier than they were required to do to protect public health. And so I have every confidence that they will continue to take a leadership role as we gradually reopen the economy. To those businesses that are reopening on Monday and beyond, I wish you every success. Thanks to your hard work, Monday is the first step on our pathway out of this crisis. While this is a positive step forward, the coming weeks and months will not be easy. You will continue to face huge challenges, but the government has put in place 12 billion worth of supports for businesses, including the wage subsidy scheme, grants, low-cost loans, write-off of commercial rates and deferred tax liabilities. Today, Cabinet agreed details of the new €250 million Restart grant, which will provide businesses with grants of up to €10,000 based on your commercial rates bill from last year. It will give direct grant aid to small businesses to help them with the costs associated with reopening and re-employing workers. The grants will be equivalent to the rates bill of the business in 2019, with a minimum payment of €2,000 and a maximum payment of €10,000. The scheme will be available to small businesses with turnover of less than €5 million and employing 50 people or less that were closed or impacted by at least a 25% reduction in turnover due to Covid-19. The scheme will open for applications through the local authorities next Friday, the 22nd of May. These grants are in addition to the suite of supports already in place and are an extra helping hand to help businesses open their doors again and get back on their feet. Thank you.
Thanks very much, Heather. 2 months ago, the Taoiseach and I stood here and asked you to do extraordinary things in the face of an extraordinary threat. We asked you to stay at home. We asked you to keep your distance. We asked you to pull together by staying apart. And the collective action of people across Irish society has now clearly changed the course of this pandemic. In the face of great challenge, the control you are showing has prevented catastrophe, and it has protected our country from a much different scenario than the one that we have today. We are so grateful for all that you've done, and we hope you, the Irish people, can see what you have achieved. But we also know that many lives have been lost, much pain and suffering endured, and I'd love to join my colleagues in telling you that it's done, but I'm afraid we can't because this is far from over. We've changed the course of this virus, but we ourselves cannot now change course. Each phase of our experience of this virus requires us to embrace new and previously unfamiliar ways to stay safe and to protect each other. And the next phase is no different, because you see, the virus is not out there. It's in us. It's in people. And if we don't control how we act, we will not control how it behaves. So today we are asking some more of you. We're asking you to continue to stay at home, to continue to keep your distance, and to continue to practice good hand hygiene. But we're also asking you to help us as we take the first step on our journey to a new normal. From Monday, phase 1 of our roadmap can commence and our economy and society can start to reopen. The roadmap is gradual and phased. That's not by accident, it's deliberate. We're treading carefully, knowing that increased movement brings increased risk. And that's a really important message I want to get out there. Anytime we increase movement, we increase risk. We're going slowly, knowing that this is the safest way to move forward. And we're asking you to do the same. I understand how compelling the opportunity to retrieve some semblance of normality from the ability to return to normal places will be. These times we are living in have brought us many significant moments, but never in our history has there been such a heightened sense of national excitement about the chance to go to a garden centre. But that doesn't mean we should all rush there at once. This reaction is natural, it's only human. I want us all to be able to enjoy the simple pleasures back in our lives. Meeting a small group of people we've been longing to see in the flesh, going to a favourite park or a beach that perhaps has been closed, participating in some much-loved sport, going to the hardware store. But we have to remember we do these things accompanied by risk, and we have to act accordingly. It is how we do them that matters. The opening of the garden centre isn't the danger. It's what we all decide to do in terms of how we behave when we go there. Reopening these places comes with some risk, but ultimately the level of risk depends on how all of us use them. We're depending on each other to continue to act in this new way. Never before have we been so interdependent. We have to continue to stay home, apart from the exceptions that Taoiseach has set out. We have to continue to stay within 5 kilometres of our home, even for these new activities we're regaining. We have to stay 2 metres apart. We are moving to a phase of greater freedom, but with this does come a greater sense of responsibility from all of us, for all of us, to embrace the ways we need to act with even greater discipline. But we must be motivated to do this, because if we can get it right, there's a big prize. We can keep moving forward and at the same time keep saving lives. And we have to remember that just as our actions brought about the progress we've seen to date, our actions could also set us back. We've seen in other countries restrictions being eased and then being reintroduced. We need to try and avoid that together. Let's ensure we don't risk that. We've gone through too much to risk that. The people of Ireland have sacrificed too much. So we move forward with great faith in what the Irish people can achieve. And when I look across the world, I've never been prouder to be Irish. We have shown strength, we've shown unity, and we've shown we can do this. But today we're asking you to continue with us, to continue to trust us, and to continue to follow the public health advice. So we are asking you to stay home, stay safe, continue to protect each other, and hold firm.
We've continued to meet as a National Public Health Emergency Team. You're aware that we'll have met yesterday, assessed the conditions in relation to the disease, in relation to compliance and behaviour recommendations on the part of the general public, and in relation to the preparedness arrangements that need to be in place for after the point at which we ease restrictions, and concluded that the time was right for us to advise through the Minister for Health the Government to consider easing the restrictions that have now been announced today. We'll continue to meet all the way through this to monitor the path of the infection. We've managed to do great work as a country to avert, as has been said, a path that we were on to a very significant challenge, first of all in terms of public health, and then second of all in terms of an impact on our health service, and to avert that and to drive the infection down to a level where we know the infection is still in the community but at a shrinking level. We're going to have to keep it there through the incredible good work that we're doing as a country. And it's now, as has been said, even more important for the personal behaviours that have been adopted by Irish people, new things that we're all conscious of, that we've learned how to do, that we're going to have to keep doing together individually as a society. And the more we move through this phase of restrictions and hopefully further phases of restrictions, the more important it will become what each of us can individually do to protect ourselves, our families and our communities from the spread of this infection. That will become more important than what the government or organisations do. It will be what you do for yourself and how you stay compliant with those personal behaviours. But we'll keep monitoring the course of the infection, the levels of compliance in terms of our behaviour in the population, and all of the other parameters that we think are important to inform the advice we give to government, and we'll hope that we continue to be in a situation to give positive advice to further ease the restrictions, but also to put us in a position whereby, if the need arises, and we're not predicting that this will be the case, but if the need arises, to recommend measures that might need to be taken if things that we haven't predicted occur. And we'll continue to meet and report to you on that, and continue to report on our assessment of the disease through our regular press conferences every day.
Okay, thank you, Taoiseach. Minister Stephen Rhodes. We're going to kick off with some questions. First up, we're going to Diane Connor from Varadkar.
Hi, just to clarify on the face mask, is this a mandatory or is it advisory in public transport? And also in relation to homeware versus hardware stores, if hardware stores are selling homeware, what is the situation and vice versa? And thirdly, just in relation to obviously the timely reporting of figures is extremely important, and has been the issue with the Mater Hospital. Has it been determined where the fault lies in relation to those cases that were late being given to the department?
Just on the face covering, so we are advising people to wear a face covering if they're using public transport or if they're in a busy enclosed space, like, for example, a shop. But it's not going to be a legal requirement. And there's two reasons for that. First of all, the science around it indicates that it may be beneficial, but it's certainly no substitute for all of the other things, like washing your hands, social distancing, and respiratory etiquette. So we really need to emphasise that. It's an additional hygiene measure. It's not a substitute for social distancing and for other forms of hygiene. But also, secondly, there are some people who have allergies, for example, to face masks and face coverings and things like that, and we have to bear that in mind. And it is a face covering, and there will be lots of information made available to people, videos showing people how to make face coverings at home, when to use them, and how not to use them, and how to use them, because we think that's going to be important. When it comes to surgical masks, so when it comes to respiratory masks, while there is no shortage of them at the moment, if we had millions of people using them every day, there's a risk that it might lead to a shortage for our healthcare workers, and we don't want that to happen. So that's why we're advising face coverings in preference to face masks. I don't know if anyone wants to take the hardware homeware one.
Yes, so I'm happy to comment. So, Heather, do you wish to comment on the hardware homeware? Do you wish to?
Well, no, I don't mind. Yeah, I'll do it. But first of all, hardware is now you're allowed to have open. The hardware shops are allowed to open. In terms of homeware, they're not allowed to open. So it's fairly simple there. Now, I know you're saying that there are hardware shops that have homeware, but if you're predominantly a hardware shop, you can obviously stay open and sell all of the products.
Can I just on the face mask issue? So we will, as the Taoiseach said, be putting up some videos and guidance as to how you can actually make your own. We'll also be, and it is guidance, we're very eager that people don't criticise or judge people who are not able to wear a face covering. This won't be for everybody, for a variety of reasons. People could have allergies. People with autism or other conditions could have sensitivity issues in terms of wearing a covering on their face. We also aren't recommending in the guidance that anyone under the age of 13 wear one either. So all of this guidance will go up on the department's website and useful videos, and you can try it making your own as well. And there is a very clear difference between the face covering and the face mask. Look, in relation to the issue regarding the timely reporting of data, this is very important. We're trying to make informed decisions, and the Chief Medical Officer is doing an excellent job in chairing the National Public Health Emergency Team, and obviously timely reporting of data is very important in that regard. It's not just important, it's also very clear in relation to regulations, the obligations that people have in terms of the reporting. I've spoken to the Chief Executive of the HSE today, Paul Reid, and Paul and the HSE are investigating this situation in relation to the delay in passing on, and that not to the patients, I should say, or not to somebody with Covid-19, but to the central reporting system. I want to await the receipt of that information before commenting further. The HSE today have also written out to all hospitals, reminding them of their statutory obligations in relation to this. And I think the Chief Medical Officer might wish to comment further. Just in relation to the face mask, and as has been said, we cannot regard face coverings as some kind of magic shield in relation to this disease. It's a supplement to the other measures that we're recommending. As the Taoiseach has said, the evidence isn't very strong in relation to the value, and we do have good evidence for this disease that hand transmission is really important, so hand washing has to be maintained. We're concerned if the message was to get out about the value of face coverings and to be interpreted in a way by people that meant that maybe we don't need to worry about washing our hands as much, or if we wear a face covering we can disregard the requirements in terms of social distancing. That is not the case. So this is an additional hygiene measure. It's not a magic bullet for this disease, and that has to be understood.
Next we're going to go to Pat Leahy from Taoiseach and Gavin Riley from Varadkar.
Thanks. Taoiseach, Downing Street was briefing that there was a telephone call between yourself and Boris Johnson earlier. Can you tell us about that? And secondly, with regard to the businesses and industries and so forth that are opening, and particularly with regard to construction, what level of inspection or supervision will be in place for that? Is it the case that in most cases just simply the word of employers will be taken that they have sufficient measures in place, or is there going to be an inspection regime?
Okay, so when it comes to the inspection regime, the protocol that's been agreed by government, unions and employers means that there's going to be a designated worker on each site and in each workplace. So we won't be just trusting the employers, even though I believe we can trust the majority of employers. There may be some that we can't trust, and for that reason there'll be a designated worker or warden, if you like, in every workplace who will have responsibility as well. And the HSA, the Health and Safety Authority, will be the competent authority for compliance, inspections and enforcement. The objective isn't going to be to shut down businesses, it's to help people comply. We know for sure that there are going to be teething problems in the first couple of days. I've no doubt that on Monday morning and on Tuesday we will see images in the media and social media of things happening in workplaces that shouldn't be happening. That's what has happened in other countries as they've opened up too. So we anticipate that. But the approach will be to encourage and require businesses and workplaces to comply in the first couple of days, and if they don't, then enforcement can happen, including the closure of businesses, including prosecution and fines. But we're not going to leap to that. We understand that it's going to take a little bit of people working together in the initial days at least to get this exactly right. In terms of phone calls today, after Cabinet I rang the First Minister and Deputy First Minister, Arlene Foster and Michelle O'Neill, just to let them know what we were doing, and we'll have a quad, that's a meeting involving the Taoiseach, the Secretary of State and the two Health Ministers, First Minister and Deputy First Minister, next Tuesday to talk about further cooperation in areas where we need to cooperate when it comes to COVID. And then had a call later in the afternoon with Prime Minister Johnson, which really was an opportunity to tell him what we're doing here, to also talk about the travel restrictions, because we've put in place travel restrictions, so have they. We need to make sure that they're aligned, so our two teams are going to work together over the next couple of days to try and get that right, if you like, within the confines of the common travel area. Not straightforward, but we're going to do our best to get it right so that the common travel area is protected, but also so that we can introduce and enforce that 14-day quarantine on people coming into our ports and airports. The Cabinet did decide today to make it mandatory for people to fill in those forms. So regulations are being prepared by Minister Harris. Once those are signed, it will be mandatory for people to fill in that declaration and fill it in correctly when they arrive at our ports and airports. And then we're going to examine means by which it can be enforced thereafter. That's not straightforward, but that's the next step after we make the forms mandatory. We also discussed Brexit as well, which I'm sure you're going to ask me about. And as you know, those negotiations are ongoing.
Well, sorry, what I was going to say just is that 14-day restriction, that will continue to apply to people from the UK, because the UK government yesterday seemed to be under the impression that that was being reviewed.
The position is that anyone arriving into our ports and airports will be required to quarantine for 14 days. There are some exceptions, like pilots, cabin crew, hauliers, for example, some essential workers. But for the vast majority of people arriving into Ireland, into our ports and airports, they have to fill in the form. That's going to be the law. And they're also required to quarantine for 14 days. And that will apply to people travelling from Britain. But we will treat British citizens the same as Irish citizens. So if you're an Irish citizen flying in from Birmingham or a British citizen flying in from London, you will be treated the same. So there won't be any discrimination, if you like, against British citizens. There is an exception, of course, or there are a few exceptions, but one exception is transit to and from Northern Ireland. So a lot of people travel from Northern Ireland to Britain through Dublin and vice versa, and they will be allowed to continue to transit.
Just a couple of points of clarification, if I can. First of all, Minister Harris, just following on from the issue in the matter, are you confident, or can you say at this point, that full contact tracing has been pursued of both the professional and personal contacts of the staff in the Mater Hospital who are the subject of these belated reporting? Also, can any of you clarify, can indoor construction, like home renovations, for example, can that begin again on Monday? And if so, why? Or if not, why not? And also just on horse racing, we hear from some other political sources that Cabinet today agreed to move horse racing forward from a later phase, I think, to phase 2, 3 weeks from Monday. Why is that, and why is it now considered acceptable that someone could drive the length of the country to attend a horse racing meeting but not drive 20 kilometres to see their friends or family?
Yeah, the horse racing was never specifically mentioned in the plan that we agreed back in April, so now it is, and horse racing behind closed doors will be allowed to resume from the 8th of June. And that's just taking into account what's happening in the UK and what's happening in France, because this is a big economic sector. A lot of people employed in it, worth nearly €500 million to the economy each year. And because people won't be able to travel to race meetings, the amount of movements happening are going to be very limited. It's people travelling to and from their workplace, essentially, but won't be open to spectators, not for the foreseeable future. But it is a big economic sector, a lot of jobs, a lot of income, and we need to be aligned, or more or less aligned, with what's happening in the UK and France in that regard. Sorry, the other part of your question was?
It was about indoor construction.
Yeah, that's home renovations. No, is the short answer. In later phases, solitary work and indoor work will be allowed, but we do appreciate that when it comes to construction sites in general, it's not as simple as just saying indoor or outdoors. You know, you start on a construction site, it's all outdoors at the start, but by the end, as the walls go up and the roof goes on, it becomes indoors. So, you know, that form of construction can continue, provided it's done safely in accordance with the guidelines. But no, it wouldn't be possible for people to, get their kitchen redone or something like that. That would be in a later stage.
In relation to the Mater Hospital, I don't have a huge amount to add to what I already said. I've been in this role long enough now to know not to provide assurances that I have yet to receive. But I obviously do note the statement of the Mater Hospital in relation to what they've said regarding contact tracing, and also the comments that the Chief Medical Officer outlined yesterday and what may well happen in an occupational health department. So this is a matter for Paul Reid of the HSE to investigate and to provide an assurance to me in the department, and that work is underway now.
Next up is Sean from Newsroom.
Thank you. Mr Humphreys, could you just provide a little bit more clarity on the homeware hardware, because there's still quite a bit of confusion from people. How can businesses, say, who want to open and aren't sure which they fall into, how can they find that out? Particularly, could someone say, was there anything else that was in the Phase 1 document published a few weeks ago that isn't going to be allowed to happen now on Monday? And just to go back to the matter as well, for the Chief Medical Officer or Mr Harris, this does raise obviously concerns about the figures that we have had to date. Do you have any more concerns about that? And do you think this was an isolated incident, or could there be others in hospitals in the country?
Okay, I'll take the hardware and homeware. Only those stores who are providing homeware incidental to their primary retail functions set out in the original essential services list are to reopen in Phase 1. It is not intended that stores which might also classify themselves as homeware but primarily sell items such as furniture, bedding, curtains, kitchenware, crockery or other such items, etc. should open. So if you have a hardware shop and they happen to have maybe a small homeware section, they're allowed to sell. Okay? But if you are a homeware shop and that's your main line of business, you can't open.
When we had our last video conference of European heads of state and government, Chancellor Merkel said to all of us, Germany's been ahead of us in reopening their country. She said to you, it's much easier to shut down a country than it is to reopen it. And that's a classic example of how things can be complicated. And, there are lots of stores that are open now that sell more than just groceries, and they have been open. So, we appreciate that's not going to be entirely straightforward, and there will be grey areas, but we will iron out any difficulties over the next couple of days. In relation to the timely reporting of the timely reporting of COVID cases, I think it's fair to say that the matter is being investigated.
Can I just add on the homeware hardware thing, because Minister Humphreys has obviously outlined the position. I think we need to remind ourselves as to what we're doing here. I mean, the advice from the Irish government, informed by public health experts, is that you should stay at home. So we're expanding the areas in which you can go out. If you need to buy a new pair of curtains, it can wait a couple of weeks. If you need to buy a new bed cover, it can wait a couple of weeks. It's different to obviously needing to go out and buy hardware. And as the Taoiseach says, obviously there'll be some shops that are hardware shops that sell a bit of homeware. We get that, but let's not kind of get confused here in relation to what we're trying to do here. We're trying to remind people they need to minimise the times they leave their home, and they need to minimise their visits and their contacts to save lives and keep people well. So we need to keep on coming back to that. Now is not the time to decide I'm going out to dicky up the house and buy a new pair of curtains. That can wait.
And the reason why hardware is being opened is because it's building supplies for construction. That's we couldn't really go ahead with construction and not allow people to buy the items necessary for construction, which is hardware. Whereas, as Simon says, when it comes to homeware, which is, I suppose, bed linen and pillows and lots of other things, that will have to wait till a later phase. Now, I know some people say, how come some things include and some things aren't? The real principle behind all of this is that we want to reduce the amount of contact and human interactions that are happening every day. And then reopen it in phases slowly. So, the mix could have been different, or the menu might have been different, but the principle behind it is that we want to make sure that the amount of personal interactions and human interactions is contained, and where they do happen, that they happen with social distancing and with good hygiene. Yeah. That's why, it could be 5, not 4, but you get the principle. Sorry.
I think it's important to remember too that a lot of the homeware stores are currently trading online. We have been working very hard with the Leos right across the country, providing trading online vouchers for businesses to get online, and also then for the larger retailers, there's a retail online scheme, grants of 10,000 up to 40,000 available, and for the other one there's grants of 2,500 available to get online, and plus another 2,500 when you spend the first 2,500. So there's loads of opportunities here to get homeware. If you want to buy homeware, there's plenty of Irish companies providing that service online. And for those that aren't, I'd say go to your local enterprise office, get your trading online voucher and get online.
Well, that is a press conference taking place there at the Government Press Centre on Taoiseach Leo Varadkar, the Minister for Business, Heather Humphreys, the Minister for Health, Simon Harris, and the Chief Medical Officer, Tony Houlihan, just outlining the first phase of easing restrictions that will take place on Monday. That press conference is continuing across on RTE News now. Just to recap what was said, the overarching advice is still to stay at home. You may go to work. You may leave your house to go to work only in those permitted categories such as construction and so on. Otherwise, you have to continue to work from home. You may leave to shop for what you need. Hardware stores, garden centres, bicycle repair shops will be open from Monday. You may leave your home to exercise within 5 kilometres, or for a medical appointment to take care of others, or to meet friends and family outdoors in groups of not more than 4. The new point there, an additional piece of public hygiene advice, and it's an advisory, not a legal requirement, that face coverings should be worn on busy public transport and in enclosed public areas such as retail. Again, advisory, not legal, and not for those aged under 13. There will also now be mandatory form filling for those arriving at the country's ports and airports. Our science correspondent George Lee is still with me here. George, this issue of face coverings, advisory, not a legal requirement, but a lot being stressed there about the need for personal responsibility.
Yes, and I think that came through, the issue of personal responsibility, in each of the speakers raised it as such. So they are relying on people to remember that the main ammunition we have against the virus is our own actions. And so when they lift the barriers in terms of behaviours, they still want people to behave as if it's there, to be very, very careful. So when you look at the face mask issue, for instance, I'm sure there are many people who are very happy that there has been some guidance in relation to it, because it's been a very big debating point, and other people who are very happy that it's not mandatory because they would have issues with regard to it. But
and it is coverings rather than masks.
And isn't that interesting? Because we know that the Health Service requires in this country 9 million face masks every single week, and their concern is that I think actually maybe every day. The concern is that we'll end up competing with the Health Service for the really good masks. So they won't even use the term face masks for the public. They're using face coverings, and they will be advising people in relation to how to make them or where to buy them, but they don't mean for people to go around as if they're a doctor and a nurse in scrubs. That ultimately that you've got to remember, it's not about protecting you with regard to the face coverings in public. It's about protecting other people. And they know, for instance, there's a lot of debate about whether or not they are effective. Some studies in the past would have found that the likes of some materials in those face masks, homemade ones or just those coverings, that they can actually make the spread of virus to you even worse, because it captures it. So it really is about educating people about using them. And I'd say we'll see a lot of videos, a lot of education, and hear a lot more about that. And
we heard that from the Minister for Health, saying they were going to be putting out videos on how we can all make these face coverings at home for ourselves. Let's go to our Belfast studio now, and our correspondent Vincent Kearney. Vincent, it was interesting there that the Taoiseach said he did brief the First Minister and Deputy First Minister on the plans after the Cabinet meeting this morning, something he had been criticised for not doing previously.
That's right, a very different approach to earlier this month when Leo Varadkar announced the Irish Government's 5-point plan. The Northern Ireland Executive wasn't given any advance notice of what he was doing, despite there being a memorandum of understanding between the Government and the Executive. Northern Ireland's First Minister, Arlene Foster, and other politicians made it very clear they were very unhappy about that, because at the time there'd been lots of talk about the need for cooperation and communication, so they felt they'd been left out of the loop. And then Minister Regina Doherty, of course, course, added fuel to the fire. At the time, she said it was more important to inform Irish people what was happening before telling the Northern Ireland Executive. Now, that, as you can imagine, didn't go down very well with many people here and politicians. So a very different approach today. Leo Varadkar making it clear that shortly after the Cabinet meeting, he immediately called Arlene Foster and Deputy First Minister Michelle O'Neill, simply to brief them, as a courtesy call, if you like, to tell them what was happening, before he then called British Prime Minister Boris Johnson. And he's also revealed that on Tuesday of next week, there'll be a conference call involving himself, Taoiseach Simon Coveney and Arlene Foster and Michelle O'Neill. So it certainly would appear that those lines of communication which might have been damaged earlier this month have now been repaired.
All right, Vincent in Belfast, thanks for that, and George here in studio as well. Well, that concludes our special broadcast. That government press conference is continuing over on RTE News now. But from all the team here, thanks for watching. I'll be back with the 6-1 News, but until then, have a good evening and take care.